Okay, great. So thank you everyone for joining. I'm sure folks will keep hopping in. We'll talk through logistics before we get into content for just a second here. My name is Vidya Murthy. I serve as COO here at MedCrypt. I am generously joined by two of my colleagues here, whom I will ask to introduce themselves as well. Clayton?
Hello, everyone. I'm Clayton McNeil, currently the VP of Sales Engineering. I was formerly the VP of Engineering at MedCrypt, and I spent a lot of time working on architecting our PKI solutions.
And I am Nick Atwell. I am the Senior Manager over Cybersecurity Regulatory. Before joining MedCrypt, where I've been here for 2.5 years, I was a PKI Manager at Cerner.
Fantastic. Super excited to talk about this. I know that there is a lot of content out in the universe about cryptography, but the nuances and applicability to medical devices, I think, is one that, in our experience over the last, call it 6 years, talking to medical device manufacturers exclusively about cryptography and vulnerability management and security, we've learned quite a bit about this space and kind of wanted to share with folks. So, from here, we will get started with our slides. And just so folks know, we will share the deck afterwards as well as a recording. If you have to drop for whatever reason, you can obviously watch the recording in full subsequently. So with that, I will turn it over to Nick to get us started.
Thanks, Vidya. And I will say, if anyone has any questions, feel free to chime in, put them in the chat as we go. We are more than happy to have this be fairly interactive and not just be a lecture until we get to the Q&A section. So if something relevant pops up when we get to a slide, please let us know. But before we really get into the actual cryptography elements of it, I feel like it's important to kind of understand, why are we doing these things? And the FDA basically tells us whenever we're developing devices, they need to be safe and they need to be secure. With that comes basically a secure product development framework and actually understanding where the risks reside. And from that, we really start getting into controls, talking about the things within Appendix A, which one of them is obviously cryptography. With that, Vidya, can we just go to the next slide on this one? With the secure product development framework, it's multiple stages, as you're all probably aware, going through the design, the development, the deployment, and even the decommissioning of it. So how are you going to ensure your device is secure from everything from the very first threat model all the way to decommissioning it to ensure any PII, it's all safe, there's proper authentication on it. When it comes to the device itself, what assets are on it that need to be secured? Are we using crypto keys for secure boot? Are we using any sort of cryptography for authentication? All of this really comes back for me to your risk assessment and what are the risks and what controls do we need to be applying to mitigate those risks? Does it have to be cryptography? No. Is cryptography a great control to be using though in these? If it's properly implemented, absolutely. And the proper implementation of cryptography is pivotal. This is something that if you basically do not have a strong integrity to your roots, to your CA, to the hierarchy itself, to the private keys you're using cryptography is more, it makes you feel safe, but it's not actually providing the security you assume it is. With that and other risks, the FDA is going to expect you to understand what the supply chain security is, be transparent through it itself. Thank you. Be transparent. I mean, security through obscurity is not security itself. If we can't be transparent of how we're securing devices, then it's really not that secure. There's a reason that crypto algorithms are published. It's because they're secure and there's trust behind them, and you can actually see why they're secure and they're not obscured. And then at the end of that, we also have to consider, once the device is on market, what could go wrong and do we have the agility to continue keeping it safe? Part of that comes with the SBOM monitoring, and then part of it, especially these days, is talking about your crypto keys and are they agile? Can you get to a quantum crypto state by 2029, whenever the NIST algorithms are going to start pushing for that? Now we can go to the next slide video. All right, so getting into the crypto itself, FDA actually really relies on NIST for a lot of this. If you're doing any sort of crypto using NIST approved algorithms, is extremely important. Anything that's not approved, you're going to get pushback on FDA from. So if you go in saying, yes.
There's actually a question from Jeff asking, can you share your thoughts about using out-of-band NFC technology instead of PKI to pair a medical device? Assume they're already encrypting the data.
Clayton, is that one as the engineer you want to take?
Sure. So without going too far into the technical details, I think whenever you're looking at your PKI and your distribution, I try to look at building a system that is fundamentally secure with cryptographic principles, and then looking at the transport mechanisms on tops. I've had this conversation with some folks that will say, you know, for example, we have a proprietary RF protocol that we're sending messages across, and it would be extremely unlikely for anyone to be able to break it. Can we take a shortcut or do something a little bit different? And when you look at that and do the analysis on that, you may find that, yeah, it may be very likely that, no one's ever going to be able to break that or figure out what's going on there. But is it cryptographically sound? Now, in some situations, you just have to look at what the practicality of your hardware is, and you've got to make those determinations. You can't have everything be, as bulletproof as you may like, right? But I don't like to start there. I like to say, can we actually build something that's cryptographically sound where we can, not that we'd ever actually calculate it, but we could mathematically calculate how likely it is something's going to be attacked or have that system broken, and then start layering in, transport constraints and things like that first.
Clayton, can you see the question? He said that wasn't his question quite. We're using,
Sorry.
yeah, he says they're using AES 256 already. The question was only about pairing using OOB, not PKI.
So I'll take another crack at that, and then maybe at the Q&A when we're talking about pairing, I generally ask the question, what are you doing with your identity? And we're going to talk about it a little bit more when we talk about authentication. So if we're strictly talking about pairing, right, and in the sense that we're having two devices that are actually going to communicate in the field, yes, you might be able to do some things different. You may not need to use PKI just to pair the devices, right? But do you have a plan for establishing an identity for the data that's going to flow in between those? Or are you only relying on pairing and symmetric keys and things like that to set up your communication? You're saying at that point it's confidential. I think when I get to my part about authentication, we'll talk a little bit more about, the importance of identity. And Nick, if you have anything you'd like to add to this, please do so.
No, I mean, I think it really comes down to whenever you're talking about the NFC, and I'm not an NFC expert, basically how secured is it? Are there ways we can break it? What does the future of it look like? Is it something that within a couple of years, the algorithm will need to be updated? And what is your ability to update that on the device itself?
There is another question in the Q&A, but I think maybe get through the slide and then we can come to that one when it actually comes up.
Yeah, sure. So I was actually just looking at that question. So yeah, I mean, as I was saying, whenever it comes to designing your crypto, understanding what NIST expectations are going to directly align with FDA. FDA is not prescriptive in the type of algorithms to be used. They're more high level of saying NIST approved algorithms, which is why things like AES 256 and elliptical curve cryptography are the standards right now. And then even beyond the standards itself, talking about how you're authenticating. Is it a one-to-one authentication? Do you need mutual authentication? Can it be just the client to server authentication? All of these are questions that really need to be asked very early on in the design stages to understand how you're ensuring the device remains safe. So are you using certificates to validate the endpoints on the servers? Are you using certificates built into applications, devices, so the server endpoints can validate it? All these things really come down to the assets themselves and how you're protecting them. And then with that, if we decide we do need to deploy certificates, deploy keys to do that, how are we keeping those safe? So it's really a cyclical process to say, let's address the risk. And as we address the risk, if we're adding additional assets to it, how we're protecting those as well. This is something where PKI really goes down the rabbit hole of ensuring safety of even if you have keys stored on an HSM, that's great. It's a FIPS compliant HSM level 3, 1, 4, but how's the HSM being secured? Is it in a cage? Is it behind access control doors? Does it have IMAVIN controls on it so keys can't be tampered with? All these things really come into question when it comes to PKI and ensuring the integrity of it. Because as soon as you can't prove the integrity of a PKI, in my opinion, it should stop being trusted. So there's a lot of logging in it and a lot of repudiation topics that come into play with PKI. And that just really goes to support these last two topics of ensuring the confidentiality, integrity, and authenticity of data being communicated and being agile for post-quantum cryptography, potentially by 2029. All right, and we can go to the next slide. So actually talking about how we take the guidance requirements, which can be loose, and applying these to the actual devices as we're developing them. Let's start getting into that, and Clayton will jump in here in just a minute and do real deep dives. But high level, the FDA is going to be talking about using strong crypto algorithms. Again, this really goes back to NIST. And then once we have those, understanding that we have to protect them. Keys that are available on a device are not protected keys, especially in bring your own device type of environments. And of course, this all comes back to essentially the CIA triad. Is it confident? Do we have confidentiality? Do we have integrity? And in this case, are we actually providing proper authentication for our devices? Moving on to the next slide, we get, not sure what happened there. We get a bit more specific, again, just talking about what type of algorithms are being selected. Again, go follow NIST on these for best practices. Key management, are they on a TPM? Are they on an HSM? How do you know those keys are actually protected? Because again, if you can't prove to me a key has always been protected, it should not be trusted. And then again, talking about the authentication, do we need mutual authentication? Do we need one-way authentication? It really depends. It comes back, as always for me, what's the risk? What are we doing to protect against it? Is it acceptable? Is it unacceptable? And then, of course, keeping the sensitive data protected, both in transit and at rest. So do you have symmetric encryption done on the device? Are you using asymmetric encryption between and then negotiating down a key? All of this comes into play when we're really talking about keeping your device safe and the patient safe using the device. And I'm going to hand it over to Clayton now to do some more deep dives on the engineering side of all of this. Do we want to look at Johnny's question in the chat first? For a medical device, if you had a trust anchor certificate embedded in a TPM or some other secure storage method, then use operational certificate store in a Windows certificate store, looking for thoughts on if the long-lived trust anchor certificate is required.
Want me to take that, Nick? What are you thinking about?
Go for it, because my first thing is it depends.
Yeah, many things depends.
Yeah.
I'm reading this question as, do you absolutely need a long-lived trust anchor? And to your point, Nick, it absolutely depends. But I will give some examples of where we found it useful. And they generally surround situations where you have systems that either from a capability standpoint or from a new module standpoint, being new physical devices that are interact with the system, they're going to expand. And you need to have something on the device that is going to allow you to expand your trust to these new devices that may be yet to be implemented or yet to be designed. And in that case, we have successfully leveraged long-lived trust anchors as basically a place where we can add in more branches to a trust context as they're needed later. Is it absolutely necessary? No, it's not absolutely necessary, but again, it depends. It also is, what do you mean long-lived trust anchor? Do you have to have a 30-year certificate on your device? Not necessarily. If you're regularly updating and you have a way of swapping out your root certificate securely, then you can use something less. So as Nick said, it depends, but I have seen situations, especially in larger systems, where it's useful to have a long-lived certificate there.
I mean, I really want to highlight one of those things you said is, do you have a secure way of updating the root? If not, then yes, a long-lived certificate is going to be pretty mandatory for your device, but it depends on what processes you have in place and what capabilities you've built into the device for that exchange.
Absolutely. Okay. Let's start with the slides, and then we'll get back to the Q&A. So Nick laid out a few of the different requirements that FDA is really concerned with, and I'm going to go through them. We're going to kind of talk about it, like just from our perspective, what we've seen our customers use, what we've advised, what are some things to careful attention to. So when it comes to algorithm selection, really the sagest advice is go look at the NIST approved standards and, select the one that is appropriate for your hardware. So when you're selecting an algorithm, you got to think about, what are my constraints when it comes to hardware? What are my constraints when it comes to available computational process? Is this a system where I need to have low latency, and therefore when I renegotiate a link, I got to be cognizant of how long that's going to take with a particular algorithm. But generally speaking, NIST is going to recommend that you use modern elliptic curve for medical devices, or if you have the space, you can use an RSA key. And I think as long as you look at the NIST requirements, you're up to date with that. You're going to be in a pretty good spot. Obviously, you're not following NIST if you try to roll your own custom cryptography, but it is worth pointing out why that is a pitfall. And very rarely do I come across customers who are trying to do their own math, right? Like they're trying to invent their own cryptography. Usually where this pitfall comes in is, if you have someone who's particularly savvy, they may try to actually do their own implementation of the math, the underlying math. That's to be avoided because there's lots of testing. It's not FIPS compliant. But generally, I see folks trying to do some sort of creative scheme with how they're encrypting things, how they're moving the data around, how they're mutating the data. And generally speaking, it should be avoided, right? You should just use, standard cryptography techniques with standard key types and just go through, a well-known crypto library. Again, if you're following NIST, you're kind of getting that for free because nothing in NIST tells you to roll your own crypto, but it's worth pointing out because, customers sometimes fall into that trap. When it comes to post-quantum, it's something to be aware of. And I think these last two really go hand in hand, post-quantum and cryptographic agility. I think you have to think about post-quantum, but most devices today are not situated to handle post-quantum algorithms. The keys are too large. They're too slow to process. We don't even know exactly what keys we're going to standardize on. There are some recommendations, but, nothing's really out there that like this is going to be the one you should use. There was a mention of, when we go to PQC, how we're going to do key exchange. There are some techniques where you can basically use PQC to sort of establish, authenticity between the devices, and then you can sort of fall back to Diffie-Hellman. But for all we know, there could be new algorithms that allow you to do the key exchange directly, right? So it's less to me about like, hey, how am I going to jam this into my system, but more this cryptographic agility, right? Do I have a way in my system where when post-quantum becomes the concern that everyone thinks it could possibly be, I'm able to transition my device? And what we have found is a lot of implementations of cryptography are very rigid. They're almost hard-coded, and they don't have the flexibility to swap out their key algorithms, let alone, some of the other things required in establishing trust, like their certificates. So these two things, in my mind, are very well paired. But even beyond that, even if you're not talking about a post-quantum cryptography, we've all seen cryptographic libraries have flaws in them, sometimes very fatal flaws. Heartbleed comes to mind. And if you can, having the ability to abstract your system in such a way that if necessary, you can change, the algorithm or even the implementation of the algorithm that you're using, that could pay dividends if you're in a situation where your device has that enhanced attack surface and could be compromised. You go to the next slide. Okay. So the other point is key management, and this kind of goes a little bit tangentially to the question that I think Jeff was asking, which is, if you're not using a PKI, can you do some of these other things to basically establish that keys are trusted and that they're secure? And the answer is yes. And sometimes you have to. It's still, you have this question of identity, which we're going to get to in a moment. But one of the things that I have seen far too many times is that customers will think that, hey, as long as I pull down a crypto library and I run the commands to establish the key and I save it somewhere in the system, that's it. I now have cryptography. I'm now having a secure system. And there are a lot of things that need to be considered when you're talking about generating keys, storing keys, and just all around key management. Just to go through a few of these. So obviously secure key generation. When you use these algorithms, they're pretty much all based on having a certain level of randomness on your system, right? So you need to make sure that the device, especially when you're dealing with lower powered devices, embedded systems, that device actually has the ability to have what they call enough entropy, enough randomness to securely generate a key. And by securely generating a key, there's two parts of that. One is generating the key in a way that when it is stored on the system, talking about the second part, it's not going to be accessible, but also generating it in a way that the mathematical guarantees that you're looking for when you pick that algorithm are actually going to be realized, and that someone can't guess what the key is based on some sort of flaw in your system, right? So secure key generation is something that often goes overlooked. Secure key storage, this is another thing. Obviously, the industry standard is to use HSMs, especially if you're in a data center application. A lot of folks don't have access to HSMs on their devices. If you're lucky, you might have a TPM. Although even with TPMs are really designed to secure the system boot up process. There are ways to leverage the TPM and some of the hardware keys that are inside of it to extend that security to the operating system. But just because a TPM and an HSM are not the exact same thing, and they have different functionalities, and it's a little bit of a nuanced difference, and it takes a little bit of expertise if you're going to use a TPM. But even TPMs, unless you're running a system that has a modern operating system, you may not have that on. And now you're looking at things like non-volatile memory, on-chip memory. You're looking at different protection schemes and boot up encryption. But nonetheless, secure key storage is a fundamental tenet of having a secure system, because if your key is compromised, then your whole system's compromised. And I even go further. I say, especially in medical devices, because unlike a server sitting in a data center, your level of physical protection may be far less. It may be possible for someone to pull out a screwdriver and actually start scanning your memory and looking in depth for keys. We see this a lot in our customers that suffer from IP theft, right? So it's worth putting a lot of time and thinking about how am I actually going to secure the keys. Secure key distribution. This often comes into play when you have a system where you're going to be using symmetric keys. There are some advantages to using symmetric keys. Again, I have to reiterate, it's best if your device has a unique identity, but there are certain situations where symmetric keys are what fits the bill. But how are you generating those symmetric keys, and how are you getting them onto the system, right? By definition, you can't generate the key on device and leave it only on that device. It wouldn't be a symmetric key in that point. So are you taking the proper protocols into mind? Are you taking the proper process into mind to make sure that when the key is distributed, you're limiting access to that key and you're moving it through whatever infrastructure you're having in a secure way, which also means thinking about, hey, I may need to have some infrastructure that has some security tenets applied to it. We've helped customers design secure key distribution systems in almost all cases. That does require having some level of asymmetric keys for the authentication of the nodes that are transmitting that sensitive data. And then the last part of key management is key rotation. Keys should only live for a certain amount of time. How much or how long they should live depends on how often they're going to be used, the context they're going to be used. There's math that you can do. But really, I've always recommended to customers, a good time to rotate your keys is when you're doing a software update. You're already in there changing the state of the system. If you're doing that every, year or every couple quarters, that's a good time to consider having a key rotation process. It does make your infrastructure a little bit more complicated, because now generating keys and establishing trust to that key is not a process that only happens in manufacturing. It also has to be able to happen in the field. But that is an important part of key management that should be considered.
Hey, Clayton, has the FDA talked about key revocation or key rotation at all?
Yeah, so when they talk about it, they talk about it in the context of, and I think we have a slide about this, but they talk about it in the context of making sure that throughout the life of your device, the device is secure, right? And they don't get into particular details about how to do the key rotation or how to do the revocation. But to the point I was bringing up earlier, if you have a device that's going to be long lived, that's going to be out there for 10, 15, 20 years, it is a fact that over time, the security of the key becomes increasingly compromised. And so by default, you have to have a rotation mechanism, or you have to have some ability to refresh that identity. If for no other reason, what if the device gets compromised, right? How are we going to make sure that we can get that device back online? We don't want to just take that device and throw it in the trash because its identity has been compromised. So they do make reference to it when they talk about having security throughout the life cycle of the device, and particularly when they talk about some of the things revolving around manufacturer security and security of the device as it's going through its entire life cycle.
Yeah, and I guess the one thing I would add, anecdotally, we have seen device makers get rejections or comments back from the FDA commenting about key lifetime. So if you have a key that's expected to last a certain period of time, or you have no plan to rotate, we've seen folks get AINN details around that. So for what it's worth,
Yes.
I guess the point I'm trying to make is that if the expectation is the FDA doesn't understand key management, or that they're not looking with that level of scrutiny, that's certainly something we've seen change in the last 18 months.
Yeah, and to be, particularly pedantic from my perspective, this is a conversation Nick and I were just having earlier before this call. Obviously, how long you use a key is also related to how long your certificate life cycle is. And so generally when you're going to do a revocation of a key, you're going to revoke a certificate. FDA is definitely talking about how long are your certificates out there, right? You shouldn't necessarily have, 30-year operational certificates for your device. So in that regard, and it's sort of indirectly related, but they're definitely looking at what is the life cycle of the assets that you're using to secure your communication. I think we go to the next slide. Great. So we were just talking about key management. The FDA, excuse me, explicitly talks about key management. One thing they spend less time talking about is device provisioning. So a couple times in the last slide, you heard me refer to the requirements on infrastructure, like how are you actually going to generate these keys? How are you going to get them enrolled into trust? How are you going to distribute certificates? And that goes by a bunch of different names, but internally at MedCrypt, we generally lump that into the category of device provision. So if key management is how do you on the device generate your keys and protect them, device provisioning is all of the infrastructure needed to make that happen, and then to also take that key and make it trusted by other devices. And they have a lot of interplay. You can't do key device provisioning without having a strong understanding of key management, because I would almost say that device provisioning is a superset concern. Not only are you thinking about the key management of the device, you're also thinking about key management of CAs. You're also thinking about key management of all the infrastructure that's going to be used to do the communication. We talked about key rotation. So that means you're going to have generally some mechanism in the field that you're going to be able to go back to the authority and say, hey, I have a new key. I want to be able to get that enrolled into the root of trust. And so you really have to be thinking about device provisioning when you're bringing a device to market. And like I said, I think that's something that the FDA, isn't currently going into great detail about how you do that. But we've spent a lot of time helping folks think through those problems. And the reason why you got to go through this device provisioning process is because the thing the FDA does talk about a lot is authentication, and the fact that your devices should have an identity, and that identity should be traceable, right? So, if you have just a symmetric key and all you're doing is taking that symmetric key and distributing it to all your devices, you might have some level of confidentiality when you're communicating, but you're not really tracking the cryptographic identity of that device. You're not really tracking what's going on that device through its entire life cycle. And yes, there are ways of approximating that with symmetric keys, where you have unique symmetric keys and you keep a registry of them, and you say, I know that this symmetric key is for this device. But that goes back to the point we're taking. You're now talking about device provisioning, maybe not asymmetric key device provisioning, but you're talking about, hey, I'm instantiating the concept of this device, and I am attaching metadata to that in the form of these are the keys that are associated with it. And however you get there, it's an important concern to think about. Go to the next slide. And then just talking a little bit more about this, the places where the FDA does talk explicitly about it. the authentication and authorization, right? So making sure that you have an identity and you're then able to, within your system, say this identity or this device is able to do these certain things because I know what the device actually is. But the other side of it that is sometimes less thought about is your supply chain and lifecycle management. So from the supply chain security standpoint, typically when you want to first bring these devices online to test them, in order to properly test them, you probably are going to need an identity. So that means the initial establishment of a identity often takes place in your manufacturing facility. So you need to be able to secure that. You need to have an understanding of what processes and what individuals are going to be involved in bringing this device online and establishing that initial identity and making sure all those processes are secure. We've built entire systems for customers that are, from a standpoint of there's clinical trust, which means, hey, I know that these devices are trusted in the clinical context, but I also need to make sure that I have all of the devices, the test stands, all of the manufacturing infrastructure also secured. And just a little bit of a tip, when you do that, you want to make sure that they're secured differently, right? You don't want some piece of equipment on the manufacturing floor to have the same level of trust or be even trusted in the same way as a device that's going to be talking to another device in the field. So building up another security infrastructure for you to be able to manage that manufacturing, then also, as I was saying, with the key rotation, the lifecycle management, being able to take devices in the field. So, if you're going to do it in the field, that's great. If you're going to send out a technician, but even if you're going to have some sort of centralized hub, a repair facility, for example, where you're going to ship devices, that needs to also be included in this secure infrastructure that we're talking about. So in many cases, this is a multi-site, multi-facility, even multi-organizational problem. How do you secure your supply chain for the life of the device? All right. And then, just talking about this, the FDA, we mentioned this earlier, is big on, hey, these devices are going to be out there for a decade plus. What is your plan to make sure the device stays secured, right? And we're at this bit of an inflection point with all, the post-quantum talk, right? One conversation I often have with customers is that even if your device isn't able to handle post-quantum, if you're going to have long-lived roots and trust anchors, you really need to be thinking about post-quantum because, almost for certain, this matter is going to be resolved in the next 25 to 30 years, right? So the FDA specifically talks about ensuring the longevity in this evolving landscape. And when we talk about that, that's when we talk about that crypto agility. And before I mentioned some of the tenets of crypto agility, but practically, how do you put that in practice? I mentioned making sure within your system that maybe you're looking at having an abstraction for how you end up, how you work with the cryptographic libraries that you choose underneath. So, when we've designed systems for customers, we have also take great pains to choose the correct libraries for a particular system because each library has its different strong suits, be it how fast it operates, the algorithms it supports, even just, support. Sometimes you need customizations for your particular situation, which vendor is going to provide that. But those relationships can change over time. So designing your system in a way that, maybe at a company level, everyone is interacting with crypto in the same way, but underneath you're being able to make, selections that are based on that particular product and that particular device's constraints can pay a lot of dividends and benefits moving forward. Goes along algorithm agility. Clearly, if you're using something right now, in 10 years, you're probably going to be using something different, right? We've already seen this with past algorithms being phased out by the NIST standards, but we know this is going to happen going forward. These two things, again, go kind of hand in hand, but also making sure that you're not doing anything that, if you can help it, that is particularly tied to that algorithm. I'll give you an example. We had a customer who needed to swap out their library because they weren't able to use the license anymore. But the particular implementation of an algorithm on their library had some, we'll just say, some magic numbers in it for some encryption they were doing. And as they were trying to swap that out, they could only swap it out on one side, and it was a bit of a problem because they kind of had to reverse engineer what that algorithm was doing. Trying to think about those constraints beforehand, if you can, if you have enough sort of foresight, is really useful. And then obviously, with future-proof design, that's kind of summarizing everything. To the best of your ability, you want to make sure that you don't paint yourself in a corner. But I would definitely say I'd rather, and this is some practical advice, I'd rather you pick a design that is simpler, that you know in and out, than trying to add a bunch of extra stuff to future-proof your design. Because the one thing about security, as we all know, is the implementation is probably more than half the battle, right? You could have the best design, but if it's not implemented correctly, if you've got one hole in your fence, right, regardless of how strong the rest of the walls are, something can slip in. And so future-proofing your design is absolutely something you should try to think about. It can absolutely pay you benefits. The ROI can be huge. But if you're just starting out, keep it simple, right? And if you think, hey, I know that this product has a long life cycle, and I know that there's going to be all these different extensions, that might be an opportunity for you to think about. Let me work with experts who think about this every day, so that I know the simple stuff can be covered, and maybe some of the more advanced things, I can talk it out with them. All right, I think that covers my slides. Great. Questions? We have any questions?
So I'll launch a poll here for folks who want to have another conversation with Clayton. Feel free to answer there. While that is running, let's do some real life scenarios and talk about what we've seen.
All right. I think it's probably best if we just you'll get two perspectives here. So I'll kick it over to Nick, since I've been talking for a while, and then I'll come in and we'll go back and forth.
Sure. And I'll preface this by a lot of this really comes down to the two words we all hate to say, but it's absolutely applicable. It depends. When we're talking about the unpredictability of the network connectivity and how it affects the validation and revocation of a medical device, this really comes back to the design, also the risks that go with the device itself. If we're talking about a glucose device that has to check in with a certificate before it functions, and it has to check in every 14 days. If someone's going to go camping for 21 days, what does that mean to the patient? So these are all things that really have to be considered when it comes to the design of the device, and what happens when a CRL can't be downloaded. What happens if they can't do an OSCP check to say, yes, this valid certificate should be trusted or it should not be trusted. So when it really comes down to the risk profile of the device, really, and the design itself for how dangerous it can be, and all those things have to be threat modeled out at the very beginning.
So going back to what Nick just said about threat model, I think absolutely it comes down to your threat model. I worked with a customer, and basically they said, hey, there's no way to get this device connected, right? There's no way to get this device connected to some sort of authority. And the solution they ended up going with was they were able to limit how long their certificates were valid, because the device only had sort of like a 2-week life cycle, right? And in that case, you do the math, you realize, okay, well, maybe I don't need to have revocation in this particular situation, because the device isn't going to be around that long, the key isn't going to be around that long. If I just revoke that key, or not, excuse me, if I just set the expiration on that key to be really low, that's a way that I can sort of achieve similar security benefits. But what I tend to tell folks when it comes to the connectivity problem is, and this is saying unpredictable network connectivity, and there's a bunch of different ways that connectivity could be unpredictable. I mean, if it's unstable, right? If you're dealing with some sort of cellular signal, okay, well then, we're going to have to put some resiliency in how we do data communication. If unpredictable is, hey, I don't know when I'm going to have connectivity. I know that I'm probably going to have it once a year, but I don't know when in that year. That's when I go back and I talk to folks and I say, hey, listen, well, what are you doing? What is your patching strategy, right? Because be it patching or things like certificate revocation, you have to get data from some sort of authority onto the device, right? And even if you say, hey, except in situations where you have like consumables and those devices aren't going to be long lived, even if you say, hey, well, listen, I don't have any mechanism for my PKI or for my certificates to bring that information. The FDA is telling you, hey, you got to be able to patch your devices, right? Because we know vulnerabilities are out there and nothing ships perfect, right? So, as product security people, I try to get that conversation into the patching one, and say, well, what are you doing there? And then try to take advantage of those opportunities to have network connectivity, to do everything that I might need for network connectivity, and making this fast enough so that it's not, adding undue process time when you're doing those updates. But fundamentally, you have to have some mechanism of getting the data, be it a revocation list, if you're using OCSP, getting whatever the active state of the certificates, but also getting things like patches and software updates. You got to be able to get them down. So you got to have some way of connecting to the system. If it's not a direct connection, maybe it's an indirect connection where you're going through a laptop or something like that. But you have to build into your system some ability to modify and update it.
Clayton, there's a question in the Q&A, I think that relates to this. Are there acceptable paths for device security but keep them non-connected? In other words, is the only way to go to is to have devices connected to a centralized infrastructure to get updates, etc. And I think that speaks to kind of what you're alluding to now.
Is that the only way to secure a device? I'd want to ask some questions about where your thought process is, but my inclination is to say no, that's not the only way to secure a device. There are, as I was saying before, there are situations where, for example, using symmetric keys. And generally speaking, those symmetric keys are going to be put on the system at birth or at manufacturing. So if you're doing something like that, then no, you might not need periodic updates. I've definitely seen systems where they are completely isolated from the internet, but there's a lot of network communication happening back and forth because there's multiple nodes, and you got to consider the security there. And there's a lot of different tricks that you can play. In some situations, I've seen where rather than having a centralized authority, you kind of have like a local authority. So if I've got 30 devices that all need to talk to one another, one device is given the role of authority, and then when keys need to be rotated, it happens there. Certainly, that sometimes happens in hospital systems, right? Where, you're not going to be talking to some central authority on the internet or some manufacturing authority or some manufacturing plant, but you're going to be talking to something in the hospital. So I wouldn't say you always have to go up there, but I would definitely say that you need to have some way to update the system, even if it's USB, right? Even if there's no network connectivity and you're going to use some sort of, user authentication and a USB stick. You need to have some way of updating that system.
Okay, I think we had also a poll question related to validation here. Let's see, did that work? And I think there's a hand raised, so let's do that. Brent, go ahead. I think you have to unmute yourself.
Sorry, I think that was a misclick on my end.
All good, no worries. I don't know if you want to speak to the question.
Oh, I'm sorry. Where's the question? I apologize.
The poll. So the poll, how does unpredictable, just so folks get the kind of final answer here, right? There was a comment about how does unpredictable connectivity affect cert validation and revocation? Obviously, you just talked about it a ton. I think where we landed in terms of most people voting here is it makes consistent cert validation and timely revocation checks unreliable, creating possible vulnerabilities in the PKI trust chain, which I think is the takeaway that you want folks to have here.
Yes, and one other thing I'll say is that I think we're out of the phase. In fact, I know we're out of the phase where you can say my device doesn't have connectivity, so therefore the vast majority of these security concerns don't apply, right? You may have different constraints. You may arrive at different answers, but you still got to answer all these questions when it comes to your submissions about your device, right? You can't just sort of put a blanket statement out there that says, well, my device isn't connected, so I don't have to think about these things. You do need to think about these things. And in some cases, it may make your life a little harder. Maybe not in the engineering side, because you may say, I don't have any way of implementing these things, but you may have to think more on the sort of threat model side to say, I don't have any way of implementing these things, but let me go through the reasons why I believe that these are not concerns that we have to worry about. But you're going to have to evidence that. You're going to have to explain yourself. You're not going to be able to say no connectivity, don't worry about it.
Yeah, and I will add on to that. Recently, we've definitely seen an uptick in deficiencies where FDA, for better or for worse, has not always contextualized a device properly when considering the controls implemented on it. So we might see devices that have extremely low risk, very little tech in them, barely even considered a cyber device, but the deficiencies will come in not really aligned to that. So the better you can be clear on why you feel you may not need a certain level of authentication between two parts of your device, because basically you've identified there's no assets going over there, or it's a one-way view-only connection, the better off you will be when you go to FDA by going ahead and being upfront as to why you don't have these versus having them poke questions.
Great. Speaking of questions from the FDA, the next question. How does the FDA view self-signed certs?
If I have seen any deficiency around certificates more so than the self-signed, I would be lying. The FDA does not like self-signed certs. They view them as a risk. And I've seen, like I said, I've seen more deficiencies around self-signed certs should not be trusted more than anything else regarding certificates.
So from an engineering perspective, the self-signed cert topic I find a little maddening. But let's clarify it a little bit. When we talk about self-signed certificates, and Nick, chime in here, we're talking about the fact that I have a key for a device, and that device is establishing its own certificate for that key, right? Which effectively means you have no trust, right? And you do see this in systems. You see this in systems where a certificate is not being used to establish trust. It's being used to convey a key because it's a convenient format for moving public keys, right? And you really have no trust at that point, right? Like, so it's an interesting thing to point. You could generate a certificate and have no trust here. There's an interesting point, which is if I am my own authority, obviously the root certificate is going to be self-signed. Can I generate my own self-signed certificate? And in that case, you can. Like, I don't think the FDA is saying, hey, you're not allowed to generate your own root keys, but you have to know what you're doing. And it's more than just going into OpenSSL and generating a self-signed certificate, right? Anyone who's looked into CAs and how they actually operate, there's documentation that you have to put together. There's actual processes. In some cases, there's actually compliance that you have to follow. That being a CA, being a proper CA, right? If you go in the X.509 specifications, they talk about being a proper CA or a compliant CA. There are things that you have to do in order to do that properly. And in most cases, I have found that, for various reasons, customers have not been able to, check all those boxes. But I do think it's worth clarifying because I have seen some confusion. Like, well, where do I get a root certificate? And is it the root certificate self-signed? What they're talking about is just basically generating a certificate for a key that you generate on the device that has no bearing on trust or doesn't link up to any sort of chain. And in that case, you're definitely going to get your hands slapped.
Okay. I think we have a polling question leading up to the next topic. What are some common mistakes to avoid when implementing cryptography in medical devices? So we'll give the question a second here for folks to respond in the poll. So far, I think everyone's getting we're getting a lot of feedback around everything being common mistakes that were outlined in the poll questions, right? Nick, do you want to start with that one?
I mean, yes, the question does sum it up nicely that whenever you're deploying this, a lot of things can go wrong. And that's pretty indicative to PKI in general, not just for medical devices, even in IT infrastructures, is if you do it wrong, it's one of the few solutions that you don't just push an update. You basically burn it down and you start over again. designing PKI into a device itself is going to be similar. That if you have issues with the CAs you're using, you're probably going to have to look at different CAs and migrate and then push out a new root of trust chain on that. The actual deployments, if you miss steps in threat modeling, if you miss steps in the risk assessment on things that can go wrong with keys, it's going to lead to these issues. If you're someone that you have, like Clayton talked about, a short-lived device that's out there for 2 weeks, you might be making hundreds of thousands of those devices. What happens when you have to have a mass revocation event and now suddenly either one, you can't revoke because you didn't build a CRL deployment around it, or the device doesn't have the coding into it to check the CRLs to invalidate the certificates. What's going to happen? How much is that going to cost you? What's the organizational risk behind that? And and it can be massive. This is why anytime we're talking to clients, threat modeling and risk assessment is where we spend, frankly, a lot of the time. Because if we miss things here, it has a massive downstream impact, regardless if it's PKI or any other type of assets we're talking about on the device itself.
So I've got so many thoughts on this one. I'll try to keep it brief. Implementing cryptography and just in broader your product security, it can be complicated, right? Especially, if you're coming not from a background of security, if you're coming from a background of maybe more, worried about clinical functionality. There's a lot of details. It's really detail oriented. And so my biggest advice, I'll skip the mistake part and talk more about the advice part, is that there are a set of listable sort of paradigms that you should be thinking through, or best practices is a better word, best practices you should be thinking through. And I always advise, hey, start with designing a system that is adherent to those best practices. Don't start with all the exceptions that you think you need to make because of the particular constraints of the new device. You'll definitely get to that. But if you start with, hey, what is the best possible, most secure system that I could build? And then handle those constraints on an as needed basis, you're less likely, in my experience, to enter in a situation where you made an assumption that either is not a helpful assumption, one you didn't really need to make, right? Like the system could support that, but you were thinking about things in a slightly different way. Or you made a assumption that ends up reducing the security of your system. For example, I had a customer who, high level, how am I going to secure my keys? Well, I should be looking at a secure a piece of hardware, maybe that's secure. Should look at encrypting. They started right on, hey, I could rate a custom FPGA basically block that I'm going to shove my keys in and secure. And they built their entire system kind of on this assumption, right? This bottom up assumption. And then the schedule came out, and the folks who were working in the FPGA, they didn't have time to write this block. Well, now they're scrambling because rather than starting with sort of normal best practices, they started with this very sort of niche. Well, I have this constraint or I have this opportunity, I'm going to use it. And then to what Nick was saying, the whole thing had to get rethought, right? If you start at the top and say, let me just use best practices, let me use sort of standard building blocks. And then when you come into a situation where you're saying, well, I can't do this, there's no other way around it, then start at layering in your exception. You're going to end up with not only, I believe, a more secure design, a design that is better implemented, but a design when you come back to it 6 months in a year, you're going to have a better chance of understanding what actually is going on because it's doing things in sort of a predictable way. And so avoiding that tendency to get clever, I think is important. I think that's maybe one of the most common mistakes to avoid is the tendency or the desire to be clever in your implementation. Yeah.
All right. And if folks have other questions, please don't hesitate to drop them in the chat. The next one we had here are, what are the primary challenges unique to devices compared to enterprise IT?
Clayton, I will let you take this one first because
Whoa.
I come from more of the enterprise IT background specific to PKI.
So, and this really came to bear, early in MinCrypt's history. Devices have constraints that IT departments are not aware of, they don't think about. So if we just there's a couple key things. So just on the device side, you have additional constraints, right? We don't have megabytes of memory, right? We have kilobytes, and you can only have a few, right? That's one easy constraint to think about. But you also have this interesting constraint in that in IT, and people may disagree, but security is a big flashing red light in IT, right? I would actually argue that on a medical device, it is second to making sure that you don't harm the patient, right? So when you go into a conversation on a medical device, security is wildly important. But you've got this other thing to keep it, which is, hey, listen, we got to make sure that we're keeping the patient safe, right? And so you can't just do everything you necessarily want in security for the sake of security, because you have this other, in many cases, overriding concern, right? That's different than, in IT where, if there's a security concern, generally speaking, it should be elevated to the top, right? I know that doesn't always happen. And, especially in businesses, you got to keep certain margins and things, and there's time constraints. I get all that. But it's like, if you knew the threat was going to happen, right? Wouldn't you prioritize security? On a medical device side, right? Knowing a threat's going to happen, right? You also have to consider, like, what is the life-saving or life-preserving operation that we're in the middle of here, right? So one of the things we had to design into our PKI was this ability that, hey, if a certificate expires, or if we see some sort of abnormal behavior, right? We actually have to think about what are we going to do on the device. We can't just shut everything down, right? We can't just sort of turtle up. We have to actually think about, because we could be in the middle of a procedure, and that procedure has to continue. So in that way, it makes it more difficult, because there's other things that you have to think about. I think on the other side, just from the IT, so that's kind of the device side, talking to the IT side. I think from the IT perspective, one thing that makes it difficult is the devices are not well behaved, right? Devices come in all shapes and sizes. To a certain degree, this mirrors the issues that are seen when we talk about the Internet of Things, right? How do I wrangle all these different devices that have all these different sort of personalities, have all these different capabilities that could be deployed in all these geographically disparate, and not only geographically disparate, but also sort of user disparate ways, right? Users having different constraints, hospitals having different requirements. How do I build an infrastructure that can tackle all of these problems? I've seen many cases where IT says, hey, well, listen, we want to just have a link that they follow, and then they connect to it, and they use our web API, and they're going to get what they need. And then you have to kindly remind them, hey, listen, this device has no ability of interacting with anything on the web, right? Because it doesn't have connectivity, or just because it doesn't have that software on it. That can be a challenge for IT teams to deal with. Nick?
I'm honestly not sure I have anything to add to that.
Okay.
Cool. We are at time, so I do appreciate everyone joining. Clayton, Nick, special thank you for all of your sage advice and insights. For those who said yes, you want to connect afterwards, we will reach out to you and we can chat. And for everybody else, we will be sharing the slides as well as the recording in an email coming out shortly. Thank you all for your participation, and we look forward to keeping the conversation going. Keep well.